So for next up, we're looking at tachyarrhythmias in children. So tachyarrhythmias is more of like the heart is beating abnormally. So tachy is beating abnormally, and this abnormally is fast. It's faster than the normal. Bradyarrhythmias is lower than the normal, right? So for the faster beating of the heart in a child, we have it that tachyarrhythmias are abnormally fast heart rhythms. So they usually originate from either the upper chambers of the heart, that's the atrias, or lower chambers of the heart, those are the ventricles. You understand? So while some are benign and they will go away by themselves, some of them they could persist and they are life-threatening. Okay. So tachyarrhythmias are heart rhythm disturbances. So the heart is beating faster than normal. Okay. So these issues could be stemming from a supraventricular tachyarrhythmias or tachycardias. So it's supraventricular, above the ventricles. Okay, it could be ventricular tachycardias. So the issue is originating from the ventricles itself. You can pause this to actually observe the supraventricular arrhythmias. Okay, several pictures on it. Just pause to observe. Supraventricular, that was from the atria above the ventricles. So types, you have the supraventricular tachycardias, we have atrial flutter fibrillations, we have ventricular tachycardias, we have junctional ectopic tachycardias, we have the Wolff-Parkinson's-White syndrome. Alright, if there's any of these which you want to actually know more about, just comment. Okay, so mechanisms of arrhythmias, of this tachyarrhythmias, is automaticity. So an area of the heart generates impulses faster than the sinus node. So re-entry cycles. So electric impulses that are leaving are also coming through again. Okay, triggered activity. So abnormal impulses triggered by after depolarizations. Okay, so symptoms by age: in infants, they are feeling poorly, irritability, pallor, rapid breathing, lethargy, In older children, palpitations, chest pains, dizziness or faintings, fatigue, shortness of breath. So some children may be asymptomatic, right? So diagnosis is what: echocardiogram, Holter monitor, event monitor, that one maybe you tell them to do an activity, exercise. Okay, echocardiogram, then electrophysiology study. Okay, so treatment is vagal maneuvers, adenosine, which is the first line of drug for supraventricular tachycardias. Then use antiarrhythmic drugs. Okay, then long-term management, you use medications to prevent recurrence, catheter ablations, then implantable devices. Okay, so that's like defibrillators. Okay, so that's it for the tachyarrhythmias in children.